Parents should bring their children to the emergency department if they're having severe symptoms that cannot safely be managed at home. This may include things like difficulty breathing or significant dehydration. Children with milder symptoms or moderate symptoms that can safely be managed at home should stay at home to try to help limit the spread of the disease. Parents should also consider speaking with their child's primary care provider or pediatrician to get recommendations on not only how to manage symptoms at home, but also when their child truly needs emergency care. In the emergency department, we're following the guidance and recommendations of the Center for Disease Control, or the CDC, and testing children with symptoms suggestive of COVID-19, namely a cough or shortness of breath, only under certain circumstances. This includes children with severe symptoms who require hospitalization, children with underlying medical problems that put them at a higher risk for complications such as cancer, organ transplants, or immune system problems, or children that live in congregant facilities, places like dormitories, shelters, or residential facilities. However, as we learn more about this disease process, these recommendations may change. Here locally, as well as around the country, children seem to have more mild symptoms compared to adults. So while an otherwise healthy child without underlying medical problems may not develop severe symptoms, they can still contribute to the spread of the disease. Therefore, it is important for them to stay at home as long as it's safe to do so. Children with COVID-19 may not display very many symptoms, or their symptoms may be very similar to other diseases such as allergies or even other viral illnesses like the flu. As long as your child's symptoms are mild or moderate and can be safely managed at home, it's important to continue to do that to try to limit the spread of the disease. Children with more severe symptoms or children with underlying chronic medical problems, please make sure you reach out to your child's pediatrician or primary care provider for advice. The news coverage and social media coverage of COVID-19 can be very easily accessible to children. A lot of the information they find may be traumatizing or frightening. It's important for parents to try to filter this information as best as possible, to try to talk to their kids about their feelings, and try to explain things to them in ways that they'll understand. Please make sure you check out the Children's Mercy website if you have any other questions or any other concerns regarding COVID-19.